Hello, my name is Magdalena Balbaum. I work at the Care Policy and Evaluation Centre based at the London School of Economics and Political Science. We have been studying the economic implications of the migrant population in health and social care in the UK, with the aim of exploring some of the current public discourse around the migrant population, such as increased pressure on public services that are already stretched, for example the NHS, or the economic benefits of filling skill gaps and contributing to workforce growth and boosting the economy of the country. We looked at four areas: migrants' use of health and social care services in primary care, inpatient and other outpatient services. Also, we looked at migrants' contributions to the health and social care workforce through lower rates of sick leave and by filling gaps in mental health services. And finally, we looked at the interaction between migrants' workforce and users of care in mental health interventions in terms of language concordance and cultural competence. We did several quantitative analyses using published data. We found first that migrants use fewer NHS services than non-migrants. Also, their tax contributions to the NHS and immigration health surcharges they pay through their visas exceed the cost of their NHS utilisation. On average, there is a net positive contribution to the NHS of around £1,200 over a year per migrant, compared to £108 for non-migrants. Second, migrants working in the health and social care sectors have less sickness absence than non-migrants, thereby reducing the disruption of services, which could lead to important cost savings in both sectors, reaching up to £240 million per year in the NHS and £220 million per year in social care. Third, migrants can fill gaps in services, helping to shorten waiting lists. We illustrated this by looking at two interventions in the mental health area, one for women in the perinatal period and the other for unpaid carers of people with dementia, with savings of around £7 and £8 million and gains of around 150 quality-adjusted life years, respectively. Finally, there might be significant benefits of language concordance and cultural competence between a diverse workforce and users of care when providing mental health interventions, with evidence showing effectiveness in reducing depressive symptoms, stigma, increased adherence to medication, and increased in provider and patient satisfaction. So all these findings help clarify some narrative and concerns often expressed about migrants in the UK, with important policy implications for the health and care system.
Hello, my name is Derek King. I am an Assistant Professorial Research Fellow at the Care Policy Evaluation Centre at the London School of Economics and Political Science. I am part of a team of researchers looking at outcomes for people with dementia and their carers. These outcomes include quality of life and receipt of services. This work is important for decision-making around the allocation of resources to support carers and people living with dementia. As part of a study called MODEM, led by Professor Subi Banerjee at the University of Plymouth, we analyzed data to see how the quality of life of people with dementia changes over time. We collected data from a sample of people living with dementia and their carers in southeast England. The sample was equally spread between people with mild, moderate, and severe dementia. Data was collected at 2 time points, 1 year apart. We collected data on their quality of life using measures completed by the person with dementia themselves and by their carer. Generally, people with dementia reported stable quality of life over the 1 year period. Carers, however, did report a decline in the person with dementia's quality of life on some measures. Declines in quality of life were significantly more common amongst those with non-Alzheimer's dementias. We therefore suggest that those with non-Alzheimer's dementias may benefit from specific support to maintain their quality of life. Declining quality of life for the person with dementia, as reported by the carer, was also associated with dementia progressing to more severe stages. This could be in terms of increased cognitive impairment, increased difficulty with personal care tasks, or increasingly disturbing behaviors. Other research we have conducted showed that the quality of life of carers does decline over time. Taken together, these research findings suggest that greater support for carers could benefit their own quality of life as well as that of the person living with dementia.